Alrighty. Good morning, everyone. I would like to call the Durham Recovery and Renewal Task Force meeting to order. Happy Friday. It's actually hard to believe that today is the last day in July. I've just been amazed that even though we've been in these unusual circumstances, time continues to really, looks like I've lost my connection. Time continues to really fly by. So last day of July, tomorrow is the first day of August. I'm really excited about today's agenda because today's agenda really allows us some space to really take stock about all of the great work that everyone on this task force has contributed to. But it also gives us an opportunity to evaluate where we are and what we have left to do for the rest of August, as well as have a conversation around what's in store for us as we move past August. So really excited about that portion of the agenda and really excited to hear more from you guys as we work to set direction for the task force. But also excited about the other items that we have on our agenda as well. So with that said, I'm gonna turn it over to our first item, which is our updates from Chair Jacobs and Mayor Shul.
Thank you, Maticia, and good morning, everybody. Wendy and I have already exchanged emails this morning. I'm going first today. It's really good to, and I've been on my bike. I want you to know I've been on my bike already this morning. I'm just bragging to you guys. I'm trying to stay in shape.
Wow.
For the long haul. But it's really great to see everybody. And just want to mention, first of all, that you all have received from myself and Wendy the letter of invitation inviting you all back to the post 100 days Recovery and Renewal Task Force. And we've heard back from almost everyone agreeing to continue to serve, and really grateful for that. Yes, exactly, Maticia. Applause is due. As you all know, the plan is to move to twice a month meeting in September, and then once a month meeting after that through May. And I just want to express my gratitude to each of you all for continuing to serve. Also on our agenda, we've been asked to give a brief update on the budget request. And just to let you all know that on Monday, the County Commission work session is taking up the budget request. And on Thursday, the City Council budget session, work session is taking up the budget request. So want you all to know that we're having individual meetings with council members and county commissioners to prepare them for the budget request so that they won't be, they'll be well informed. So that's already happened. We had several meetings with council members yesterday, one of which Katie was on, and I think that, and Ryan has been on them, so I think we got off to a good start. So I was asked to just say a few words about kind of where we are and what we see in terms of trends and our thoughts for the post 100 days for our community. I know Rod will say this in a little while, and we're going to hear from Katie and Rod on the figures. I'm so proud of how we've done. Thank you to Rod. Thank you to all of our community. Our cases, our 7-day average fell below 60. I don't know if it's still below 60 today, but we've been in a really good, on a good trend. And a month ago, we were having, we had a 7-day average of 80 cases. And when you think about what does this mean in reality, I think about our Latinx community. If we have 80 cases a day, and for 7 days, that's 560 cases. And if 80% of those cases are Latinx, you're talking about more than 400 cases a week for our Latinx community. If you're having 50 cases a day and 50% of them are Latinx, you've dropped the number of cases to 25 a day. So in a week, 100 and, what is 25 times 7? Help me, 170 something cases. So you can see that this is making a huge difference in people's lives. And the work that all of you all are doing, the work our community is doing to keep us safe is really, really making a difference. I think that there are several threats that we face going forward in the next few months. First of all is the return of the students to Duke and North Carolina Central. And I don't think there's a way to sugarcoat this. It's a concern. We all understand, of course, why the students need to come back. We all understand that we had a great meeting with North Carolina Central University's administration, and we are having a meeting on Monday with Duke, which I'm sure will also be a great meeting, where we're hearing their plans. But with Duke's juniors and seniors all living off campus, and with lots of North Carolina Central University students living off campus, and Chancellor Akinboyo expressed to us his major concern being those students living off campus and the inability to really control or influence much their behavior. And this is a major concern. Another major concern, I think, in a different direction is the fact that our Durham Public School students are not able to go back, at least initially, in person. And this is a different kind of threat. This is a threat to our community because our parents have to be parents, they have to be teachers, and they have to be at work, either at work where they leave the home where they must go to work, or at home where they're trying to work while their students are there. We know, and I'm so impressed with our Durham Public Schools Foundation and grateful to you, Geoff, for being one of the leaders of our campaign to close the digital divide in Durham. And for our school children, super important, because I really believe that this is just a huge concern going forward. And I know that we all share that concern. Another major concern and a major threat, I believe, is the lifting of the moratoria on evictions and on utility cutoffs. And we are faced with a very difficult situation. We've put more than $1 million into rental assistance when this occurs, that the city has put up and the county has put up money, and we're cooperating on that. We've put an additional $500,000 into rapid rehousing to try to help with these things. And yet we know that's not nearly enough, that when the eviction moratorium is lifted, we are going to be faced with very, very difficult circumstances for lots of people. Critical is the federal legislation and the ability to get people through the next few months. And we're all watching that, I know, eagerly. But for people to get another stimulus check and for unemployment insurance to be extended and those kinds of things are so important. So I think those are, when I think ahead about what are the things that feel very, very threatening and very concerning, those are what they are. On the other hand, I think that there are lots of opportunities that we have, and one of them is Back on the Bull. And I think if we can support Back on the Bull with a great communications plan, which we have in front of us and can fund, and the community health workers, the health ambassadors, who will be going out and working with businesses and individuals and institutions to make sure that we're doing everything as safely as possible, we can really do some great things. I think that Back on the Bull and the behavioral economics approach it takes and the health behavior approach it takes is extraordinary. And I'm so glad you can already see the signs up around town and lots of businesses. And I think the uptake has been great, and I'm very encouraged by it. Another thing, and this is something that last week when Geoff and Anthony were reporting, was it last week or the week before? I'm already a little confused about my weeks. But that they were reporting on the ways in which we need to rebuild our economy and the way we need to think about it in new ways. We have a new president at Durham Tech now, J.B. Buxton, who I know is very interested in these new workforce development initiatives. He called yesterday to talk about them, and I know he's talked to many of you all about them. And I think this is, rebuilding better is going to be an opportunity, and I hope that we can take it. And then I think another opportunity is all the things that we're learning about working together. and how we're creating different kinds of structures and different kinds of relationships. I think also about all the kinds of things that are just happening differently, that can happen differently forever and better. I think about some of the social service delivery, telewic. These kinds of things can be, should have happened forever ago. They're happening now under the pressure of COVID-19. And these are things that we can maintain. Wendy and I were on a call yesterday where she was talking with our legislators about an opportunity that we hope we will have. We're hoping that the state will be putting out an RFP for funding for purchase of quarantine hotels. And then this hotel can turn into a recuperative care hotel once the virus is beyond us. So these are opportunities, and I think that we have a lot of them. I think the reality, though, and I know that you all share this, is that we're in for a long slog. If we get a vaccine in the winter, which we're all hoping for, even then it's going to take such a long time to climb out of this economic damage that we're all undergoing. For our students to get back to schools in a way that they all want to get back to. All the things that we want are going to take a while, and we know that the enormous economic damage is going to continue. And this is a reality we have to face, and we have to do everything that we can to try to change this reality. But we also have to be leveling with our community that there's not a quick fix here, and we're all doing our best every day to do the work we need to do. I really believe that if we stick together, if we're as creative as we have been, that we can do so much to fight back against the damage that the virus is visiting on us. And I'm so impressed and grateful that this is the group of people that we have to lead it. I continue to be amazed by your work and grateful for it. So those are my introductory comments, and I'll turn it over to Wendy.
Well, thank you, Steve. You've done an extraordinary job of really outlining I think all of the challenges that we face, as well as all the opportunities. And I think I will just, I echo everything that you've said, and I'll just maybe elaborate a little bit more. When I look back at the agenda materials for today, and what was the list of the 10 things that this task force was supposed to accomplish, I was just amazed, because we literally have been working and have accomplished something related to every single one of those 10 items, and in a very short time. And not just accomplishment, but in an effective way, in a creative way, and in a way that can have, I think, positive long-term impacts on our community. So I really want to recognize that. And I think that, as Steve said, we know that we're still in this for the long haul. We don't know what the end point is. The progress on a vaccine has been amazing. Although we keep hearing about it, but from what we hear, the type of collaboration that is happening, I think, around the planet, with people working together on the vaccine work and on research, scientific research, has really been accelerated. Just like Steve said, in other areas we've seen accelerations. But I think until that happens and we go through that process, we know that everything that this task force is working on, that it needs to continue and to be sustained. And as Geoff could tell us more about, we're really looking at a very long-term economic recovery that's predicting it may be not until 2024 that we're really back on our feet again. And so when we think about, well, what does economic recovery mean? We're talking about people. We're talking about families. We're talking about people's lives in our communities. That's what we're talking about. And so I am very concerned about just general access to housing, food, utilities for people in our community as some of these safeguards are removed. And then the impact that is going to have on us locally, our local governments, our community health center, just all the resources that we have here in the community and how we're going to address those needs. And we have built an amazing infrastructure with volunteers and people working together, our food insecurity system that is being created and what we're trying to do around housing. But it's just, I think it's going to get harder with the unemployment. Look, Susan has told us that we've got 9,000 unemployed hospitality workers. So again, I think this task force staying focused on some of those basic needs, and especially for our most vulnerable residents, our Latinx community, our refugees, our immigrants, our undocumented members of our community. I'm really worried, and the mayor has touched on this, and I think this is really key with the subcommittee that's working on the key economic indicators, that the recovery, and we learned from a great presentation yesterday, the chamber has helped sponsor a 2020 employer survey, which I think is going to be so important to the economic subcommittee, is that our recovery is going to be slow and uneven. And so what I think that translates into, and we discussed, is that it will be very inequitable. So the inequities that we already have, I'm concerned about those being exacerbated, because on the good news side, what we know is that there'll be new jobs in IT and manufacturing and life sciences and healthcare. And we have jobs. These are strong job sectors for Durham County and for the region. But what we also know is that these are jobs where you need credentials, professional credentials, and you need certifications. Where do you get those? You get those at Durham Tech. How do you get access to those? Well, you need to be able to afford them. And if they're online, you need to have the digital access and the digital literacy. And if you're unemployed, you still need a way that you can support yourself while you're getting the credentials and the certification. So we need to also, I think, be very focused on how do we address the barriers to create equitable access to the job retraining that we're going to really need to hone in on to get people who are in underemployed or unemployed, low-wage jobs in the industries that are going to be severely impacted or are right now: hospitality, tourism, restaurants. How we get these people into these good-paying jobs, I think, is really going to be, in an equitable way, is going to be essential, really, really essential to our recovery over the next year. And I hope that will be a focus of this task force. And we have great initiatives happening. The Back to Work initiative, Durham Tech, the Bulls initiative that Durham County and a lot of other partners are working on. And tied to this is, as Steve said, the digital equity is a campaign that's happening, a plan, very important for I think for all aspects of life in the next year. I'm also concerned about Durham Public Schools and how we can support our families with virtual learning. I think this is going to be a challenge for all employers in our community. I'm now chair of our DSS board, and I got an email from our DSS director talking about how we're going to need to really look at our DSS staff, which is the largest. We have about 600 DSS workers. It's the biggest department in Durham County government. But the fact that now we're going to have a lot of staff that need to work from home, not just because of COVID, because, you know, of what we're implementing, but because they need to be home with their children, because their children are going to be home and they're going to have to help support them with school. So I think this is another big question for us is what do we need to provide to support our people in our community, our families for, we don't know when the virtual learning is going to end. And what about families where the parents have to leave? And then how, I know that DPS is planning learning centers, but what does that mean? And how do we look at Durham Parks and Rec, the libraries, or what other resources that we have for parents who can't afford to pay for the Y or the JCC or some other way to supervise and support their children. And again, this is another equity issue. I think we also have to stay focused on the contact tracing and the testing. And this is the heart of the way that we have been able to really, we are doing so great. I'm just so proud of Durham. The numbers, Steve alluded to them, and I know that Rod will go into this, but the information that we just got on Wednesday that the growth rate for the state is 1.3% and for Durham 0.6%. The positive growth rate in terms of the number of cases for the state is 13% and for Durham is 8%. I mean, this is huge. This just shows that all of the efforts, the outreach, the roundtables, you know, the ways that people are working together, back on the bull, our public health department, you know, our employers, everything that everyone's doing is having an impact. But again, with the students coming back, how do we sustain this? And the contact tracing, our campaign of, you know, positive norms of behavior, we do have to stay focused on it. And Rod will talk about what's happening at Holton right now, which I think is a very exciting model of how we really are weaving together all of the different needs that we have much more tightly into a real system. And I'm not going to steal his thunder, and I'm going to let him talk about that. So, and I want to also bring up one thing is thinking about who else needs to maybe be a part of the task force. George had sent Steve and I an email saying, you know, should we have some representation some way with, you know, Durham Tech, Duke, NCCU, DPS in some way. And I thought that was a really great suggestion on, you know, looking at some of our challenges are going to be related to education over the next year. And so, and I think that's a question for the task force. Is there anyone else that we really need to, you know, include and bring in? So I'm looking over my list, but I think I have covered everything, just elaborating on what Steve said. And again, I totally agree with him that this is an opportunity. Again, I love that our task force it says renewal. It's not just recovery. It's also about renewal and transformation. And I think we don't want to go back to the way things were before. We want to make things better. And so this is a great opportunity and a challenge for us. And I know that working together, that we can do it. Thank you.
So thank you, Chair Jacobs and Mayor Shul, for sharing with us, those threats and those concerns. And that really provides us with a lot of great insight for us to consider how we collectively as a task force start to address some of those items that you raised. So thanks for sharing that. So now I'm going to turn it over to Katie, who's going to provide us a couple of updates.
Great, thank you. Good morning, everyone. Happy Friday and happy last day of July. It is amazing how time has just flown with this. So let me give you a couple of quick updates. One from the vulnerable populations group. We met on Tuesday again, talked about Holton. I will also not steal Rod's thunder on that, but suffice it to say, Holton so far, a couple of weeks in, has been a really successful model. So we also reviewed, there was another testing pilot on Saturday at St. Joseph AME, and that was with Old North State Medical Society, the Community Health Coalition, and the Durham Academy of Medicine, Dentistry, and Pharmacy. That was also very successful. In fact, my understanding is it was so successful that they actually ran out of tests by the end, and actually some of those then went over to Holton, and Holton was able to extend hours by about an hour to accommodate that. So really good partnership there. We also spent quite a bit of time talking about the three phases of this crisis that we're in right now. So right now we have the initial phase of the true global pandemic and the immediate public health crisis, and that is expected to be followed by the economic crisis that we're already feeling and seeing, and then really beyond that, the behavioral health crisis. And so how do we begin to work together as a community, thinking forward around behavioral health, which we know is already a significant need, not only in our community, but across the state and nationally. And so that will be part of the upcoming discussion of that group. That group has been meeting weekly. We agreed that starting in August, we will meet twice a month, and moving forward, knowing that we can always add meetings if needed, if something emergently arises, but to allow a little bit more space between meetings for the really important work that is being done behind the scenes. And then the other update is on face coverings for the Go Durham buses. And I think Ryan may be able to give us a brief update on that, but good progress has been made.
Sure. Good morning, everyone. So the update is that our Go Durham bus system is moving towards putting disposable masks on every one of their Go Durham buses. We provided them through a contribution that the task force received with 6,000 disposable masks to get them started, and have identified a source to secure additional disposable face masks. And they're prepared to make that purchase. And they're currently working on putting on the dispensers onto the buses. Once they get those on, then we'll begin to see disposable face masks on all of our Go Durham buses. And so that's great. Quick work there to hear of a need and be able to advise and respond to it. So just a lot of credit to the Transportation Department, to Sean Egan and Pierre and others who are advancing that issue quickly.
Thanks, Ryan. That's fabulous and so important when we think about our residents getting on those buses. If they don't have a face covering and they're riding the bus once or twice before they even get to that central hub where they could pick up a face covering, that is not what we want from a safety perspective. So this is really great, very quick progress on it. I will, before I turn it over to Rod, I will give you a quick update from the hospital. So we are, for our 7-day average in terms of, as of yesterday, 7-day average for number of COVID patients per day, 64. That is down from the week before and I thought I wrote that down, but I think it was 70 the week before. So seeing some improvement there. And actually, I will tell you today, between Duke University Hospital and Duke Regional Hospital, we are at 48 cases, which is as low as I've seen in a while. say that very cautiously, but really good progress there. In terms of the ICU, we are at 20 patients requiring critical care. That's down from 27 last week. And I had to do this math a couple of times to make sure I was right. But right now, our COVID patients are 4% of our overall patients. And again, last week it was 7%. And we are at 90% occupancy between both hospitals, Duke and Duke Regional. Any questions on that? And I think you'll see that this mirrors somewhat what we're seeing overall in the community. And so I'll turn it over to Rod for that broader community update.
Thank you so much, Katie, and good morning to my comrades in this battle against COVID. We thank you so much for all that you do. And we certainly thank Chair Jacobs and Mayor Shul for their leadership and warm words. And like Katie, I am I give this briefing with a lot of cautious optimism, because we certainly don't want to jinx this good trend that we're seeing, but we continue to keep our foot on the accelerator and do all that we can to continue to protect our community. Nationally, the U.S. has gone to over 4,405,932 cases of COVID. And I bring this up because we've hit that dreaded benchmark of over 150,000 cases. The exact number is 150,283. Within North Carolina, we continue to do fairly decent as compared to our other southeastern states. North Carolina's at 120,194 cases of COVID, resulting in 1,903 deaths as of this morning. In Durham County, we have 426 active cases, which is rather low, which we will take. We have 5,215 inactive cases, meaning that many individuals have been discharged from their COVID treatment. We have 77 deaths. We did see a little spike in deaths in terms of the number of individuals. Most were recently hospitalized for a long stint and had many comorbidities. And, of course, our hearts and minds and prayers continue to go with their families. Our total now sits at 5,719 total cases since the COVID crisis pandemic has begun. In terms of contacts and contacts tracing, we continue to do substantially well with that since we began between Durham County and CCNC, CCTO, our partners. We've made 11,022 contacts. That number continues to increase. In fact, on the drive in, I was talking to the regional supervisor, and she mentioned to me that they are asking for more cases, to which I said, I will do the very best I can, but that is a good problem to have. So I just wanted to share that with the group. On Monday, July 27, we did start off with 5,562 total cases. That's an increase of 434, and that too is relatively low compared to previous weeks. Our 7-day moving average did creep a little bit above 60 at 63, but again, that does represent a decrease of 68 from last week and 72 from the previous week. So we continue to see a downward trend. So far for the month of July, there are 1,770 cases. The 7-day moving average does indeed tells us, again, whether or not the disease burden in our community is increasing or decreasing. And cautiously, I will say that it is decreasing. So we're seeing North Carolina's trajectory of lab confirmed cases leveling. And we are delighted to say that Durham's trajectory of lab confirmed cases is leveling as well. And again, as I always say, ladies and gentlemen, the Data Hub continues to show graphics and continues to be that reliable source of accurate information that is updated daily with the most recent statistics. As Chair Jacobs and Mayor Shul has indicated, as far as race and ethnicity trends, we continue to see a little more than half of our cases still involve the Hispanic or Latinx community so far for the month of July at 51.8%. The Black or African American community continues to be underrepresented for the month of July at 24.7% of all of our cases. Of course, they represent 37% of the Durham's population. And our white community continues to be very underrepresented at 15.6% of all of our cases for the month of July, while representing 54% of our total population in Durham County. Moving to work, race, and ethnicity, not much change. Ladies and gentlemen, for the month of July, we continue to see the sectors of the unemployed individuals, the construction workers, and hospital workers. 54.9% of our cases continue to be associated with unemployed individuals, majority of the Hispanic or Latinx community, and they represent 71.2% females. 87.8% of our cases continue to be associated with the construction work settings. The majority of Hispanic or Latinx, and 93.2% were male. So we give a big shout out and a thank you to Pilar and El Centro, who continue to beat the drum and ensure that they know that they need to be aware and wear face coverings and do all that they can to protect themselves. 40.2% of our cases are associated with hospital workers. They're Black or African American in nature, and 70.7% are female. So we continue to monitor these industries very, very carefully. As far as our surveillance efforts, we continue to really rely on those two areas that we have been watching all along, which is our insured population and our community-based. And we are seeing decreases in those as well. As far as insured, we see the positive test prevalence in this population at 8%, which is stable, and it has continued to dip down. It was 9% last week. And as far as community-based, and that's all our community-based efforts in terms of testing, this too is stable at 5%. And again, it was, I apologize, 4%, it was 5% last week. So we are seeing some downward trends going across the board, and we continue to be cautiously optimistic. As indicated, we do know that we have some significant things on the horizon to include back to school with colleges, universities, and public schools. So we continue to watch that. In terms of that zip code that continues to have the highest case rate at 28.25 per 1,000 people, continues to be zip code 27704, which includes stretches of Hamlin Road, Gear Street, Cheek Road, parts of Bragtown, Colonial Village, and Merrick Moore neighborhood. So we continue to do all that we can to make awareness in that particular section of Durham. We also have information about COVID-19's impact on daycare and school-aged children as requested by Chair Jacobs on last week. This data does tell us the percentage of cases confirmed in the under 18 age group as percentage of our total cases. And the total certainly lets us know how the cases are impacting this age group, whether it's decreasing or staying the same. As of today, for the month of July, 16.5% of our total cases were under the age of 18. This breakdown is as such: from age 0 to 5, 5.5% of our cases represented this age group. Age 6 through 10, 4.2%. Age 11 through 15, 5%. And age 16 to 17, 1.9%. Again, for a total under the age of 18 of 16.5% of all our cases. We monitor this very, very closely. We're certainly thankful for the relationship that we have with Duke and Dr. Ibukun Akinboyo, who you will hear from very shortly. And we certainly want to make sure that these children are very, very aware, parents are aware, and we're looking out for the best interests as they prepare for back to school. As mentioned, Duke's model that we receive on a weekly basis does indeed show that North Carolina's growth rate was at 1.5%, whereas Duke's growth rate was at 0.6%. Over the past week, North Carolina's infections have grown at 13%, and Duke's infections has grown to 8%. So we continue to reap the benefits of this hard work, this awareness.
That last part, sorry to interrupt you, that was Durham, right? Not Duke.
Yes, ma'am, it was Durham.
Yeah.
Durham's infection had grown to 8%. So we continue to reap the benefits of the awareness campaign and all the work that we're doing in the Recovery and Renewal Task Force. Finally, for Holton, that's a great partnership and collaboration we have with Duke, and it continues to expand and go extremely well. What has happened and the model that we set up is to where our contact tracers are able to, well, after case investigation and after we pass on the close contacts to our contact tracing partners at CCNC, they're able to talk to individuals and almost immediately set them up with an appointment at Holton. We set the appointment and they are able to go to testing, and they are showing up for testing in great numbers. And as Katie did not allude to, they're also bringing a lot of their friends with them. So the more the merrier. And we're able to get them tested right away. So far, since Holton has been set up, I believe back in July the 11th, we've tested 467 individuals. We've received 132 positives. And I will make one note, one caveat is that some of those individuals were retests, but for the most part, the percentage of success rate was right around 77%. So that lets us know that we're sending the right people there for testing, and we're able to, what we say in public health is box in the coronavirus very quickly, because the ultimate objective is to identify, to quarantine, to test, and to isolate. So we're able to do that very successfully, and this continues to be a very good partnership. Lots of work remaining. We continue to be motivated to fight the good fight. And at this time, I'll turn it over to my great colleague, Dr. Ibukun Akinboyo, for additional comments.
Thank you, Rod. Again, I don't have much to add. That was a great summary. I think overall, the impression is we are doing well and the trend is flattening and potentially decreasing. But as always, time will tell. And as we're doing well to maintain this, this is a time to continue what we're doing rather than peel back efforts. And thank you for the pediatric data. So over to chairs.
So Ron, I have a question for you. You mentioned when you were talking about contact tracing that you made about 11,000 contacts. And that sounds like a big number to me, but I'm not the expert here. So is that good in terms of that number of contacts? And can you just give a little bit more context around that?
Absolutely.
What that really means?
Absolutely. Thank you for that question, Maticia. It is good. It indicates that we are successful in being able to not only identify the contacts, but more importantly, get the contacts to answer the call. Oftentimes, that's the problem that we have. You know, they don't want to hear from us. They don't want to talk to us. And oftentimes, it also means that there are a number of individuals who are calling and they're getting confused. But through the awareness campaign, ladies and gentlemen, we've been able to successfully let them know that if you see Durham Department of Public Health, please answer the phone. And they have been answering the phone. It just kind of lets us know that we've been able to, you know, really communicate with 11,000 individuals who in turn answered the call, and then more importantly, gave us the information that we needed to further reduce the spread. And you know, again, we're just delighted at our partnership. We do receive a lot of inquiries from other counties as to how we were able to partner with the state mandated contact tracing apparatus and get up to speed real fast. And like I said, I mean, the call this morning was kind of mind blowing for them to say, we need more contacts. So that means that We have the contact tracing apparatus set up satisfactorily. It's working well, and they certainly need, they want us to continue to feed the beast, if you will. So we will do all that we can to get them what they need. But at the same time, I will say that, you know, not necessarily having enough contacts is a good problem to have as well.
Thank you for that.
Mhm.
Are there other questions?
I just want to jump in and just say, I really want to highlight what is happening at Holton. I think the idea that, you know, you're calling somebody as a contact tracer and then at the same time making an appointment for people to get tested is huge and really eliminates that barrier that people have. You know, now people don't have to take that second step of, okay, now where do I get tested, and I can't afford it, and you know, I might, you know, if people are undocumented or they don't have health insurance, it just completely takes away that barrier for people. And so I'm just really grateful for that. And also that Holton is also giving out food to people so that when they come and if they, you know, maybe test positive or whatever, they can get food and then they can really self quarantine. And so, you know, I just think it's just a really great model that's happening over at Holton. And also the fact that Duke's tests are so quick, you know, they're like 24 to 48 hours. You know, we're hearing these horror stories of tests that take a long time. My son is a grad student at Penn State, and he told me last night on the phone that it's taking 14 to 18 days in State College to get test results back. And they're going to have 50,000 students back in their community, which, I mean, it makes us look really good. So, you know, I just, again, I think we're really fortunate, some of the resources that we have. And Dr. Akinboyo, I wanted to shine a spotlight on you because I was talking to a school board member last night who was really excited that evidently you are now involved with, and maybe you could tell us a little bit about it, working with the Durham Public Schools and really helping to set up some metrics for them to be able to understand, you know, when do we decide how to go back to school, and you're going to be doing some research. So please tell us about a little bit more about what you're doing.
Yeah, thank you. I'm not sure which context. I feel like I've had so many meetings and seen people's faces in different ones. I sometimes try and keep track of what I'm saying where. But so this is a separate effort, but potentially cohesively approaching reducing some of the long-term effects, particularly for children, and particularly because we've not focused enough on things we're not able to measure right now. So we don't know what it looks like if you don't educate a child for a year. We can figure it out, but sometimes it may take us 5 to 10 years to realize the impact that 2020 is going to have on the next generation. And to that end, there's a lot of information out there. We queried published papers for the last couple of months, and they've been over 35,000 in 4 months produced on COVID. I have no way of keeping track of that, and I don't know how people that are not even within the typical scientific academic realm can keep track of all that data and actually use it to make a decision. So the idea behind this is just to see if we can not put the burden on schools necessarily, but come in a structured way and have some experts review data and start to collect school-specific metrics. We have lots of numbers we've tossed around. A lot of them are based on adult settings and things that may not directly impact how a school works. So seeing if we can create a safe way to collect data around schools and around children and what the exposures are, and filter that down back to the schools, answer questions that are coming in a timely fashion, and also use data to inform when a school can open and how how they can stay open consistently. And this is not to take away from any effort that's going on. We still would rely on our public health team to come in. If there's a cluster, we certainly would rely on all of our educators to weigh in on what it means to have a safe environment to educate a child. And of course, all of the policymakers and those in government, so that a community approach is what would determine what happens in schools. So we still need to reduce what spread of COVID-19 in our community, because whatever happens in the community will bleed into the schools. But that's our current focus, is to try and create a structured, I think, NIH-funded way to provide data locally. And now it seems we may be able to get it nationally done, because there's just a lot of interest and people need help. We need to figure out a way to educate our kids safely.
Thank you.
Thank you for alluding to that.
Any other questions on the data? Terrific presentation. Thank you. All right. We'll move into talking about our roundtables and any updates from the roundtables. And this is sort of open discussion. You've all seen in your briefing packet the updates from the roundtables. Brian may be able to share quickly with us any major concerns that he's hearing out of the roundtables. I know I sat in briefly on part of the fitness, Pools Fitness Centers roundtable earlier this week, but would love to hear from those who've been in those roundtables and from Brian.
So good morning, everybody. I will start with the Immigrant and Refugee Roundtable. So we are planning on a town hall, community town hall. We are planning to have it on August 25th. So we will send more information about it, but we've been meeting and planning on it. It will be 7 to 8:30 p.m. And we will concentrate a lot, of course, in the education piece. And other updates. So I think, and also we've been working in what else do we need to send a budget request to support our community. And one exciting thing about the town hall, is going to be in 3 different languages. It will be English, of course, Spanish, and French, to include our immigrant population and our refugee population.
That's terrific. Very exciting.
Regarding the places of worship, we've been pretty pleased with our 2 documents that we were able to get out. And we have moved now to meeting every other week. Some of our participants were able to host a virtual gathering about kind of returning and where churches were, places were. That was sponsored by DCIA, but and I wasn't able to participate, but it had wonderful reviews, and the request has been to look to do it again and possibly look at it being co-sponsored between DCIA, Durham CAN, and IMA. And so we're looking to do that, to have 1 or 2 more of those that would enable conversation along the entire pendulum. So those congregations and places of worship that may have gone back and kind of sharing what they've done and how they've seen things, those that have not, those that are contemplating, just trying to make sure that we're keeping everybody together and hopefully not having people going at odds against each other, but trying to have dialogue in a peaceable manner that everybody can glean and learn from. So all is going well, and it seems our numbers are kind of dwindling with our consistency of participants, but we yet have a pretty solid and diverse group. Thank you.
That's great. Thank you for that update.
And I would just say similarly, good morning, everyone. Most of our roundtables have scaled back to not necessarily weekly meetings. And some are migrating back into the organizations that have traditionally convened these groups. But we are maintaining really good collaboration with as many partners as possible. And we really appreciate the task force's consideration last week of the budget requests, many of which came up through the roundtable process. And we appreciate the city and county's consideration of those requests as well, particularly as we start to move into a time where I think the continued dealing with this, we're maybe through some of the short term, but figuring out that we're going to have to continue to work through this for quite some time.
Thanks, Brian. Yeah, certainly what I heard on that fitness roundtable was just the continued concerns about how long this is going on and the outlay of dollars that our small businesses are having to make in terms of being able to safely reopen. So everything from purchasing cleaning supplies to plexiglass to, we've certainly heard from our restaurants around the outdoor dining, et cetera. And so I think there is hope that there will be some way to do something with a relief fund, even if that is repositioning dollars from the loan fund into the relief fund. Anything else from the roundtables? All right, Maticia, do you want to lead us off on the discussion around sort of, we're at 77 days, I guess?
Certainly. And before I kick us off, I do want to just acknowledge one of the things that Mayor Shul said in his update about the emails that went out and the fact that many of you have responded that you are willing and able to continue on with the task force. I think I speak on behalf of Katie and myself, and of course, Katie can't kick me under the table because we're not close enough. But we're excited about those of you that can stay on, but we certainly recognize that this task force work requires a lot of work. It's more than the 2 hours that we spend together on Friday mornings. The real work happens behind the scene, so not during the actual meeting. So if you don't have the ability to continue on, we certainly respect that. We understand that. Because we know that everybody has other things that's going on in their lives, and we certainly appreciate everyone's commitment as we've gone through the first phase of the task force, and I've kind of referred to it now as our Durham Recovery Renewal Task Force 1.0, and we're going to transition to Durham Recovery Renewal Task Force 2.0, because that's about as creative as I can get. But again, just want to acknowledge the fact that if you're not able to continue on, we certainly understand that, we respect that. And because we know you, even if you don't continue on, we know where to find you. So just wanted to say that before we transition into the next topic. So as we think about what we've done over the past 77 days, and Chair Jacobs alluded to this when she gave her update, if you look at the 10 initial priorities that we identified when we first kicked off the task force, we have accomplished a lot of great things as it relates to those 10 items. It doesn't mean that we're all done with those items. There's still ongoing work as it relates to some of those items. So there's still work for us to continue to do, wrap up that we started with, but there's also some new work that we should probably start to think about now so that we can start planning for that. And Mayor Shul and Chair Jacobs certainly talked about some specific concerns, some focus areas for us to think about or focus on as we move forward, but would like to hear from you guys. We've been together for 77 days. You've seen how we've operated, but certainly want to hear feedback from you as it relates to specific areas that you really want us to focus on as a task force, and even to have a conversation around one of the items that Chair Jacobs raised around the composition. So do we need to invite others to join the task force and or support the task force? So just want to open up the floor to anyone that wants to start talking or sharing.
Maticia, this is Rod.
Uh-huh.
I know it's pretty weird for me to not speak about numbers and speak in general, but I do believe that George's suggestion of having representatives from Central and Duke and the school system is an excellent suggestion. I thought that the meeting between Dr. Monk and Dr. Mbenga and yourself and Katie and Mayor Shul and Chair Jacobs was a great meeting, very impactful. And I just feel as if with schools reopening, particularly public schools being such a strong sticking point, so much so to where we said previously that a lot of the different actions that we were taking within the fall as far as entertainment and venues would be centered around how that went. I just think it's very, very important for them to be a part of the conversation and for us to possibly receive updates from them. I am quietly concerned. This is something that keeps me up at night in terms of schools reopening and the impact it's going to have on my public health staff and the community. And while things are going very well, you know, I just know that, you know, this may be the calm before the storm, if you will. So I think, George, you know, hats off to you. I think that was a great, great suggestion. I hope that we can bring them on.
Thank you for that, Rod, and certainly thank you for that recommendation, George. And we can certainly work to figure out how we get some representatives integrated into the task force as we move forward.
Could I recommend in a respectful way to all of us old folks, could I recommend that we identify either younger entities, excuse me, from those organizations, or younger people or whatever. I guess the approach is we can all sit back and guess what's going to happen when college, when, you know, 60,000 people come to the area, and maybe more, because I mean, it's the triangle, right? And so UNC is also about to bring in 30,000. I think we can guess that and just continue to be scared, or actually jump into that community or reach out to those communities and see if we can get real stakeholders in those communities. I won't speak for everyone. Let me just speak for myself. There was a clear delineation between the students or the entities that the colleges had deemed were our leaders and the people that we really got information from and showed up when they decided to have something, whether that's a party or whatever the case may be. I just think there's a way to really get in front of this, as opposed to just sitting back waiting for what could happen. And it may be a way for us to kind of put our thumbs on the scale as well. I mean, like I said, I know when you come back to college, the first thing you're looking for is the big party, right? And, you know, probably a lot of students have been in quarantine somewhere, and it hasn't been in the triangle. And so I think we can get in front of that in some capacity. And I just think that we should just be more intentional about who we reach out to in those entities, as opposed to just kind of broadly approaching, I guess, people of our same age demographic who may not be as in tune or on the ground with what's going on.
And I think that's a very good point. And when you started talking, I was looking at all the faces and I was like, is he really calling all of us old? But I know that wasn't your intent. So, but that does make perfect sense, I think, because as I think about diversification comes in so many elements. And as we think about, especially college age students, to have, I hate to say younger representation, but to have more diverse representation would likely be helpful. So certainly would like to tap into your insight as we think about how do we integrate some folks from the organizations that we just named. So thanks for sharing that.
I would echo what Ed said. I think many of the students could provide a lot of additional insight as to what they're facing and what we may be afraid of them coming back, but some of them are also afraid to come back. So perhaps having a roundtable of students from the various universities and colleges would be appropriate.
I like that a lot, especially having a roundtable, because you're absolutely right. I think students are all at different levels, and you have some that are eager to get back to do all the things that they think they should be doing at college, and you have some that are really concerned about coming back, but feel that they really don't have a choice because they want to continue with their education. So thanks for that, Dr. Nelson. Mayor Shul, I think you were going to say something.
I was just what Tony said. I was thinking along those same lines, but his idea was better than mine. And I think that's absolutely great. I would love for us to be able to sort of sit in on a roundtable like that and listen. And I appreciate what Ed and Tony have said. I think those are super important ideas.
Excellent. Other thoughts as we move forward? Other areas of focus?
I do think, just to take that a step further, just thinking about it, it's important. It probably is important to understand how social life resumes on campus at Duke and Central. Like in an honest way, knowing what happens. I had a question for Rod about how the public health department syncs up with Duke and Central as they resume. I mean, is that for data, for information, is that pretty much in place, or is that like reinventing the wheel?
I can always count on George to give me the thought-provoking questions. Yes, that's an emphatic yes. We have maintained comms with Duke throughout the entire pandemic. We are working with them now currently in terms of case investigation, contact tracing. That has never stopped. Even, I had to go back into the recesses of my mind and think back to the number of students that, they were student travelers when we first began. And that has never stopped. We've continued to work with Duke. As far as Central, we had a very good meeting with Central earlier this week in terms of getting them up to speed, in terms of knowing who to talk to, who are points of contact in terms of contact tracing. And Central is going to a contract vendor, George and others, for their contact tracing. We were able to have a Zoom meeting with them and to be able to reassure them that the health department would definitely be here to assist them in as much as ensuring that that process goes smoothly. And after 30 minutes, they were all but reassured that they have a good process in place. We are in constant contact with both administrators at both universities, and we are ready. We are more than ready. So that's a good question.
One other piece I would add related to the schools is that we do have that on our minds from a communication standpoint. We have a representative from Duke Communications as part of that team. We have not had a representative from Central, but we have reached out to them individually for alignment. So that's something that's very much on our minds about what kind of messaging are we getting out there and how do we coordinate with them? So as we learn more, and some of the roundtable, which I think is a great idea with students, and some of that information comes back to us, we're going to be very sensitive to how we reinforce that through messaging channels, including some of the university's channels.
So Susan, just to follow up on that, And I think Ryan, you were the one who suggested this. I think that it's really important that both Duke and NCCU are integrated into the Let's Get Back on the Bull campaign. So again, I think alluding to what George has said, and what everyone has been saying is how do we really weave together and integrate what's happening on our campuses into our overall efforts in Durham, and as much as we can do that, the better off that we're all going to be. So I'm glad to hear that you're making that outreach with Duke, and we need to do that with NCCU, and that's certainly something that Steve and I can follow up on as well. But I think that is going to be key.
I wanted to notice that in the panel, in the chat, one of the panelists recommended Anjali Boyd to be on our panel. I just want to mention that that's Ed Boyd's daughter. So I don't know, Ed, if we can have two members of the same family on our panel, but I did want to notice that. She's a PhD.
I don't think that's a good idea.
I don't want to see you guys arguing.
Yeah.
One of the things, just thinking about one of my concerns when students come back is not just the social life on campus, but especially social life off campus. And one of my concerns related to that is enforcement. You know, we are having a discussion now amongst our city attorneys, county attorneys, the sheriff, police department, and trying to figure out what the enforcement protocol is, especially as students come back. We continue to want voluntary compliance, but we get calls. You know, there are a lot of calls that come into the police non-emergency number, and you know, some of them are, you know, big parties and that kind of thing. And as the students come back, we continue to have concerns about that. So that's a discussion that we're having. I just wanted to let the task force know that we need as much voluntary compliance as we can. And that's where I think these ideas about having students, you know, having a roundtable and having those discussions is really great. But I also think we've got to be thinking about how we're going to enforce, gently enforce, but enforce compliance of around off-campus parties and those kinds of things. They're a big concern.
And just to follow up on what Steve said, I think it's, and again, I'm kind of talking circles here, but besides, you know, the enforcement, I think we really do have to look at that to support our law enforcement, because they're kind of struggling with what are they supposed to do. But the public education piece and getting back to let's get back on the bull to help the students understand how much what they choose to do and what their behavior is going to impact everybody in the community. As Dr. Akinboyo has said, and as Rod has said, that understanding that what our students do will impact how much our businesses can open and whether our children in Durham Public Schools are going to be able to go back to school or not, because if our numbers start to rise again, we're not going to be able to do these things. I just read an article in the Washington Post this week about how, you know, young people are going out and socializing, partying, and they're literally coming home and bringing the virus into their families, their grandparents, their parents, and they're not getting that sick, but they are actually literally leading to their own family members getting sick or even dying. And so, you know, how do we really communicate that? And that gets back to what, Anthony and Ed have said about we've got to bring them, I think is a great strategy of bringing them into the conversation, because having them be able to communicate to their peers is so important. And NCCU when we met with them. They have a great model. You know, NCCU community service is one of the pillars of their university, and they have in their structure that foundation of student leaders. And they are using, we learned from meeting with them that they are already planning to have ambassadors within the university who are going, you know, students going out to talk to other students, which I think is just a fantastic model. So, you know, how can we all work together on this?
Yeah, and I know the meeting with Duke is on Monday, but I do know that Duke University, there is a compact that has been formed or developed that every member of the Duke community will sign, all of the students, all of the staff and faculty, and it talks about the responsibilities to the community, both the Duke community and the much broader Durham community. So, and the importance. So there's definitely work underway there. But I love the idea of having students in a student roundtable so we can really hear directly from them. Because I'll be honest, I question, you know, I heard this concept of, well, you know, you need to stay in your own dorm room or dorm suite and you can't go to the dorm room next door. But I was a college student once and I'm not sure that that's the reality. So hearing from them directly, I think would be really helpful.
And Katie, thanks for mentioning the compact that Duke is doing. I think that is very powerful and gets back to the idea of, you know, personal responsibility and the whole idea that we've been learning about of behavioral science and creating a norm about what the expectation is for everyone. So thanks for mentioning that.
Yeah, this is great dialogue, and I think it just heightens an area that we need to be focused on related to students. And just hearing all of this conversation and talking about the roundtables, I'm even thinking about, you know, wouldn't it be great if we pull together roundtables and start to have these students really be ambassadors on their campus to really help us make sure that the students are doing the right thing. And, you know, maybe that one ambassador can't influence the entire campus or the folks that are on the campus, but I think that person could have some influence. And I think that's really what we're looking for, folks that could rally around what we're trying to do here and help move us forward. So a lot of great suggestions and just provides yet another focal area for us to work on. So I appreciate all the great conversation around the ideas of how we engage our students.
I'd like to suggest too that we have some representatives from Student Affairs as part of that as well to hear what the students are saying. I think that would be very helpful.
Thank you.
And I would encourage us, I know the biggest concern is those where we have students living on campuses, but I'd make sure we include Durham Tech as well in this, just because, you know, they still are in college. And so certainly still are probably out socializing in the community.
All right.
I think go ahead, Pilar.
Sorry. This is not related with the students at the college, but thinking about the roundtables, I think it could be good to have one. I know there are group of parents from DPS or PTAs that meet, but if we could have a roundtable having representation from these different groups that already exist, so we can hear from them again, what are the barriers they have and how we can support them. Because I think, yes, we have an idea, but it could be good to really have them at the table and having the key people also in those roundtables so we can really support the parents and the students.
Thank you for that, Pilar. I think that's an excellent suggestion, especially as we think about everything that's happening around, like, you know, students not going back to school. They're only doing school online, and you have parents that are some that are working from home full time and others that have to physically leave home. So Great suggestion. So I appreciate that.
I was just going to elaborate on, or kind of piggyback on something Susan said earlier about the communication piece. I think that North Carolina Central has a good handle on putting together guidelines and policies for on-campus behavior from the students, but probably has not given as much thought to off-campus behavior. So communicating and helping to spread the word as to what proper or appropriate behavior is like off-campus is extremely important. Many of our students, again, are somewhat skittish about coming back to campus. And a couple of weeks ago, over 400 of them decided, well, the students and their parents decided that they wouldn't stay on campus because they were a little concerned about health and safety. So they decided that they would stay off campus. So just, again, communicating what is that appropriate behavior. What does it look like off campus, I think is going to be very, very important, as opposed to just kind of whacking them with a stick when they behave inappropriately and they didn't even know, you know, what appropriate behavior was what it looked like.
I think that's a very good point, because as I try to get over my nervousness about my son going back to school, you know, I know and I can rely on just the guidelines that we provided to him, but I just know just here in Durham and just some of the things that I hear that his friends are doing that I won't let him do. When you take that back to a campus and you have students that are coming back that they were doing things that they were allowed to do that they thought were appropriate. I totally agree that we need to provide some guidelines on what we expect folks to do in Durham. So I think that's a very good point, that we have to communicate and not think that everyone is at the same place. So thank you for that.
Well, you know, the mayor mentioned off campus. It just occurred to me, every apartment complex with a pool, with a swimming pool, is a problem in August and September. I mean, not to get granular about it, but you know, that I guess that's what's so confounding about this. You know, at the beginning, we kind of missed the congregate living issues, and now we've had adequate warning and plenty of runway, and you know, this is well, maybe not complicated, but lots of moving parts.
It is complicated, George, and that's why I'm so excited that we have the folks on this roundtable to help us figure it all out.
So this is raising for me a question of, we know the universities are going to be trying to communicate standards through the compact of Duke, and through our discussions with Central, we know they're going to be trying to do this as well. Should there be additional, messaging and expectations set from a community perspective beyond that? And if so, how would that happen? I'm not, but I'm not sure about that, but, for students, I was wondering, just thinking about all the interesting things that people are saying now, I wonder if we should give that some thought too. Is there a message that needs to come from the community that's beyond just what's coming from the universities to the students?
I was wondering the same thing, Steve, about whether it's a part of the orientation, whether there's some standards that we want to provide, coming from the task force or some other just standards of behaviors or expectations as part of orientation for college students and K-12 students for that matter. Or is it uniform information that they're receiving?
Yeah, I think more targeted information, other than, I guess we can call them standards as well, but targeted information seems to help a lot more. I mean, we see the effects that Pilar's work has created. And we've literally all been hearing about coronavirus now since, January, February. And, at any level, any decibel level, it just becomes just mundane at some point. But I know, as an entrepreneur and a business leader, when you hear something that's targeted towards small and medium-sized businesses, my antennas peak up. And so I think the same is, happens with kids. I know, even having conversations with my own son, who's 15, and we were actually trying to figure out why are certain kids still doing certain things. And he told me at dinner, he said, "Well, Dad, back in March, you guys let me ... And we began to think about it like, man, yeah, and we did that because of the level of information we had at the time, right? And so I don't think some of the things that we're seeing, I don't think they're all just being, just totally throwing caution to the wind. I think it's just a matter of not having the information at hand in some cases.
One question would be, and thinking about George's comment about having a long runway, and there is some runway here to deal with this, is what we might foresee happening as students come back, and then there's certain bars and restaurants around campus that become really problematic where people are gathering in large numbers. As much as our bars and restaurants have struggled, I would hate for us to close down all of them or have to go to much more restricted levels with all of them because of a few where there are issues with students gathering. And I know we want to be fair, whatever we decide to do. So how can we ensure that that doesn't get out of hand, that a few bars and restaurants that attract students don't get out of hand in a way that makes us feel like we have to walk backwards on all of them?
That's a great point, Susan, because I think that's what sparked the governor's order to limit alcohol sales
Right.
at 11 o'clock starting July 31st was what was happening at some of the establishments in Raleigh, exactly what you're saying. So I think what you're alluding to is there's also an opportunity to work directly with our local businesses, again, maybe to honing in on ways that we can help support them with making sure that they are able to enforce, what they need to do so that we don't have to do something like start shutting things down.
And I wonder,
Yeah, go ahead.
I wonder if we could start with the Restaurant Roundtable or the New Durham Restaurant Coalition and ask them to give some thought to that from their perspective and how we could do this.
And I was also thinking that we could go back to when Ed was talking and Lois about communication and what the message is back, could get some advice from our partners, Marielle and Duke Center for Advanced Hindsight, because I think, I don't know, how do you get that right message out there about how, we really need them to be great partners, living in Durham, being part of the Durham community, and how we make that connection between, again, the individual behavior impacting the larger community. I mean, that's what we've all tried to do with the face coverings, be kind and, how, when you wear face covering, it shows that you care about everyone else. I mean, we've been able to get that message out, but what's getting advice and from the communications team roundtable about that message.
I think part of the message can also be, Rod's good report this morning about, a number of our stats are lower. Things seem in Durham than some of the statewide things that we know are working. In other words, the hard work, the sacrifice, it's paying off for Durham. So you want to balance this is the negative also with here's the positive. Durham is doing okay right now. We want to keep it that way. So how do we convey those messages as well?
I think also, I think we can model that, right? I think at that age, well, let me not just say at that age, at all of our ages, we like messaging that's modeled and it lands well, right? If I'm that age and I'm literally looking to get to college and get away from everything I've been quarantined with, I mean, to be honest, I'm looking for a party probably, right? And I don't know if there's a way that the city, county, one of the colleges can create a social distanced party that's safe or whatever. I don't know what that thought process looks like, but it's got to be candy involved, right? Like we can't trick or treat for business cards to dentist offices, right? We need the candy. We need to, and so if they're coming to town, kids are coming to town, yeah, to learn, but they're coming to town to enjoy college life. And unless someone can be proactive and create something for them that fits within those parameters and can translate that, because in their reality, there's really no downside, right? Like if we know that this virus doesn't present, health consequences to them that they can see. I mean, what is the negative consequences on that end, right? So I think I just think there just needs to be some thought process around how do we tame this before it happens, before it goes, the wrong way. I taught middle school, for a while, and it was, the sixth graders when they come in, it's like, hey, they're walking down the hallway in a single file line, but they see the seventh graders and the eighth graders don't have to. And the only thing you can tell them is, well, by Christmas, you may not have to walk in this single file line as well, as long as you understand when you do walk through the hallways, you can't be ripping things off the wall and things of that nature. So I think someone takes that approach, that, something is provided for them that is a release, it fits in line and models what Durham is promoting, and the safety. And then obviously there's a lot of thought that needs to happen with that, but I don't think we want to deal with the converse. The converse is 18 to 28-year-olds just trying to figure out their own ways of having fun. And usually that doesn't align with any kind of public health practices.
It's a really good point. It would be great for us to think about how we create distractions, entertainment, ways for them to engage that are safe. And I'm sure the schools are thinking about that too.
So one of the things that I have been thinking about some is along these lines is, if students had a sense that there was a pod that they were in, and that was their social pod, they could party as much as they want with these 10 people. I think about when I was a student, which was a long time ago. I want to say that right now. I may not be remembering this correctly. But if I was, when I got to school, I was very close to the people in my hall, in my dorm. I was hanging around with them. And I think that, we see these pods of families forming now to educate their children. And people are kind of forming these small pods. I wonder if there's some, I wonder if it would be a good idea to try to encourage, so let me put it another way. So at Central, the thinking is, as Katie mentioned earlier, that you won't go into the room of the person next to you. And I just think that's just very unrealistic, and that the kinds of things that Ed was talking about are more realistic. And, and Katie mentioned as well, the difficulty of that. So, is it better to try to do that, or is it better to try to encourage people to have a pod with which they isolate, but within which they can be social college students? I don't know, I'm not sure, but I think when we have these discussions with our colleges and with the students that you all have been suggesting, it would be worth discussing that.
All right.
Definitely do not envy our college administrators and trying to, or public school, DPS, trying to sort this out. It is tricky.
Well, Katie, it reminds me of something that Ibukun said a couple meetings ago, which is that, it's going to be very easy to be a critic of these things. And it's all going to happen with a lot of difficulty. There are going to be a lot of mistakes. There's no good path forward. There's only not very good paths forward, and that we have to be as supportive as we can of our folks who are trying to make these decisions and help them with their ideas, but also in the community support them and really give as much support as we can because it's very thoughtful planning.
There's one thing to add to this. I think some people we've functioned in a mental model of scarcity where we're just trying to figure out what all the things that we can't do and trying to figure out the 1 or 2 things we can do. And I know, unfortunately, young people, the perspective seems to be they're coming back to college to party, and I hear the concerns around that. I think young folks are also just struggling with how to study in the context of social distancing and weighing our plans. And this is maybe not the best forum for all of the plans, but just ensuring that on a Durham level, schools there's some intersectionality around how young kids, but even just how teachers and how professors can promote studying and learning on college campuses where people are present, but we're trying to encourage them just staying separate, and that may not even work for learning. A lot of college students actually need to be in a 4 to 5 person pod to bounce ideas off. That was in essence why a lot of people actually go to college, and showing that you can do this safely in accommodating for certain things, I think will be a good idea. And that will come with time. I think the initial phase is just, we got to start something. I think colleges have scrambled so hard and tried to create a plan to get some students on campus. And if we can weigh in on what has been successful in some of our roundtables with some of our early plans, I think it would help with how we implement some of these plans. I've not been as tied to even on campus our Duke plans, but I know there've just been a lot of moving pieces. And in the next few weeks, we may have a more structured section that we can weigh in on and maybe help with bringing together the campuses in ways that may not have occurred before.
Thank you for that. Any other thoughts as we think about our way forward? So we've been together since mid-May, I think it's been, and the letter that you got from Mayor Shul and Chair Jacobs, it talked about how we're going to reduce the cadence of our meetings. So in September, we're trying to plan 2 meetings in September to transition us to monthly, and we'll work to get those out on your calendars. But as you think about the format of our meetings, would love to hear any thoughts that you have. As we put together the agenda, you've kind of seen how we execute the meetings. But if there are different things that you want to see in our task force meetings, certainly open to hearing that from you. One of the things that Katie and I talked about earlier this week as we were planning for future meetings, we think it's important for the task force to continue to be educated. I've learned a lot on the task force. The metrics conversation that we have is always helpful. We're trying to have someone really just educate us on a lot of the dialogue that you hear about there's going to be a second wave. So what does that really mean, and what does that look like, and what should we be preparing for, as well as to get some additional insight on the vaccination that people continue to talk about. So we certainly plan to do some additional education of the task force, but certainly open to any other thoughts or ideas that you guys would like to see us incorporate on our agenda, whether it's a standing item or something you would just like to see us focus on as we move forward.
So Maticia, what you just said, I'm so glad you brought that up. Us really thinking about a second wave, and Steve mentioned, flu season. But I was participating in a talk this week, and I got a question from someone listening, which was, do we have a plan for when we have a vaccine? And so I think that that's probably going to be something that people will start talking about is, what will be the plan for distribution? I've read articles talking about, if it's limited, do we target our most vulnerable populations first? What's going to be an equitable way even to distribute a vaccine? So that hopefully we're going to need to have that discussion sooner than later. But thank you for bringing that up.
Yeah, and even in Ibukun and I were just chatting about even bringing some education to this group around the vaccine research and where that stands now and what's being done, if that would be helpful for folks. And I know it's a little bit of a moving target at this point, it seems like, but at least some ongoing education around that. And even the clinical trials.
Any other thoughts?
Yeah. I'm sorry, go ahead, Phil.
Sorry, Ms. Matt. Here at Lincoln, one of our major concerns right now is how to prepare for the flu season. We've found that our resources are already stretched since we opened. Well, at Lincoln, we literally did not close, but since individuals are coming out now, feel safer coming out, each morning for the past week or so, we've had a line stretching out to the sidewalks on the street as people wait just for us to process them into the clinic. So with resources that are already stretched, we have no idea what the flu season is going to be like. We have no idea. Just the immunization of those people who want flu vaccines is going to be challenging for us. So I don't know, how we can work collectively to address the issue, because I'm sure that the health system is going to have the same challenges in its clinics, Katie, right? But that's a huge concern for us already, and something that we have to bear in mind as we plan to move forward.
Something else that I hope we'll transition to over time is we are spending a lot of time figuring out how to be really cautious and how to keep things safe. But we also need to start thinking about how do we encourage business to come back and people to go out and spend money. And I know that's been a sort of underlying or a side theme here, but it should become a much more critical point, and we want to do it safely. So we need to think about and be comfortable with how our messaging evolves over time to encourage people to do more.
Thank you, Susan, and thank you, Phil. I was trying to get my computer off on mute to acknowledge what you said, Phil. I do appreciate you raising that as a concern, because it's something that's certainly been top of mind for me as well, as we, talk about the second wave, but then you also hit flu season. So what does that mean to our community, and what does that mean to our health system? So certainly an area that I think we all should be concerned about. and certainly should have some conversations around what we can do to support, what needs to be done. And totally agree with you, Susan. We do spend a lot of time talking about preventive, like how do we prevent, but we should spend some time talking about how do we effectively engage and things so that we don't all become hermits for the rest of our lives, but we have to do that in a safe manner. So just making sure that we have a way to start to further engage in things as we feel comfortable.
So Ryan suggested, and I think it's a great idea, that we think about voting as the election comes. And we might want to get Derek Bowens, our Board of Elections director, and maybe the chair of the Board of Elections, Phil Lehman, to report to us at a meeting about their plans, so we can help think about those, because that is both a potential source of infection and, of course, super important that it go well. Also wanted to mention that when we talked to some of our city council members yesterday, they asked if we had a roundtable of workers, rank and file workers, might be, for example, people from the hospitality industry. A roundtable of those folks who we were hearing from, who were meeting on a regular basis. And so I wanted to put that forward as well.
Thanks for sharing.
Mr. Mayor, in that same vein, and also to kind of jump along with what Susan had mentioned, our team that's been continuing to meet every single week, Dr. Nelson, Ed, Pilar, Susan, Nicole, myself. If you recall, when we presented a few weeks ago, or maybe it was last week, it's a bit of a blur at this point for all of us, the underlying objectives and strategies that we had been identifying as far as like promoting and increasing resident and visitor spending, ways to mitigate additional losses, supporting the businesses that are and workers that are affected the most, supporting new businesses and jobs and entrepreneurship, retraining, reemploying people, as well as strengthening our identification of career pathways. With those underlying objectives, our team broke out over the past week and started coming up with, we sort of had a brainstorming, big ideas, and we started kind of refining those. And we look forward to sort of bringing those actionable items as recommendations to you all in the coming month. Now that we have a little bit more of a runway with this, I imagine that those things will continue to refine as conditions evolve, certainly. But we're really excited about sharing some of the big ideas the team is here with you all for consideration and to get some feedback on in that space.
Thanks for sharing that, Geoff.
And Geoff, I just wanted to say that I know that looking back at the 10 to-do list for the task force for the first 100 days, the KPIs, the key economic indicators, I think are going to be really important for us to have, and for local government to have those. I think that those will be really helpful.
I also see
that's a great point, Chair Jacobs. That was when this group first started convening in the middle of May. That was like our baseline, and Dr. Nelson and his team were very instrumental in kind of helping us identify what that looks like. What is our current condition, so we can start tracking. And then, so as we established that database, the next step of the group was, well, what's the framework? And Susan did a fantastic job of kind of guiding us through what the framework could look like. What are we trying to accomplish? What are the strategies embedded in keeping businesses surviving and keeping people working, or in some cases back to work? And so the next step is sort of these ideas that we had talked about, like, okay, what's the plan here beyond sort of some of the stuff that we're doing? So I'm pleased to hear this conversation today, because I certainly see a tremendous amount of alignment from the work that we're doing as to what is interesting to this task force.
So I do see another note here, just a suggestion that there be an update on the Census 2020. So that would be good to bring forward as well. certainly so important.
All righty. Well, great.
Maticia, I wonder if people would find it useful to hear an update from the Emergency Operations Center. You know, Jody's with us and could bring us that. Some of us hear that information on a pretty regular basis, but I think a lot of people don't and don't really know all the great things the Emergency Operations Center is doing. So I wonder if that would be a report that the task force might like to hear.
And we can certainly provide that. I'll let the task force know that starting in August, we're going to start demobilizing the EOC as it's been established for the pandemic response, and moving some of our staff back to the Broad Street location, because we are also having to pivot and prepare for hurricane season. So we go from one issue and incident to another. So certainly we can bring an update back to the board at the task force at some point.
I actually think an update on the hurricane preparedness, as we're thinking about that intersection of hurricane with COVID, and even, you know, the way we're looking at shelters and things like that, right, has to be a little bit different this year than it has been in the past. How do we have social distancing in a shelter, et cetera? So that update, Jody, would be terrific.
We can certainly work on that, and I can tell you that those plans and preparation are happening as we speak.
Thank you.
Unfortunately, you may get the first blush of that on Monday, I think, with at least on the coast.
We're keeping our fingers crossed that we don't, but it looks like more of a rain event for us. But we tend to be a sheltering area for those who need to shelter from the coast, and so that's why the plans and preparations are so important.
Thank you for your leadership on that.
And Kate, when you bring up the intersectionality again, you know, got an email from our DSS director about DSS is the entity that is involved in staffing and running the shelters. So here our DSS staff is already very strained under providing, you know, increased benefits, people working at home, and now, you know, having to run a shelter and staff a shelter for hurricane is an additional challenge. So absolutely. Thank you for bringing that up.
Alrighty, well, we're at 8 minutes, and virtual band camp has really kicked off in my house because now I hear the trumpet. So Katie, do you want to close this out?
Absolutely, happy to. Well, thank you all. This has been a really great discussion, and I feel like we've got a lot of work still to do, but a lot to celebrate in 77 days. So just tremendously appreciative of everyone's leadership here and all that you are continuing to do, and the just incredible teamwork and collaboration. So anything else before we end today? And as a reminder, we will go weekly through August, and then beginning in September, we will pivot to twice a month in September, and then pivot to monthly thereafter. So, but still weekly through August as we work on a lot of the steps you've just outlined for us. All right. Well, if nothing else, have a great weekend.
Great weekend to you.
Back here next Friday.
Thank
Thank you, everyone.